morning.
Good morning.
How are you doing today?
I'm fine.
Today I'm going to be going through your skin, your hair, and your nail assessment. So if you have any question along the way, if you're feeling any pain or you want to use the bathroom, you let me know.
Okay.
So what's your name? What's the date of your birth?
My name is Brian Nasaya. I was born April 12th, 1998.
Okay. So you are how old now?
I'm 20.
20. Okay. So Miss Mary is 20. So I've introduced myself to you that I'm Fola Shade Onosanya. You can call me Shade. So I'll be going through a lot with you today. So I'll be touching you, sorry, and if you feel discomfort, let me know. So, okay. So let me put my this thing. So we're gonna start with the inspection of the skin first, and from there we'll move forward. So this is the inspection of the skin. I'm looking at the Miss Mary. I'm checking the skin for the texture. I'm testing the skin for the color, the uniformity, if it is symmetrical, if there's any solely bilaterally the hand. Can you stretch in your hand, your two hands? So the skin is it looks so good. It's very neat, and the color is brown color, and under the skin is pink. And can you turn just the way you were before so that your all the body will be exposed? But what I'm seeing in the skin, Miss Mary has some uh facial arcing around the forehead, the bilateral chin, and what are you using for your pimples?
Something the doctor prescribed me.
What's the name?
I don't remember the name.
Okay, so you have the prescription with you, or the you can show me the cream later.
Yes, later.
Okay, so Miss Mary has a hacking over there, and I can see some bat mark. So let me measure with my tape rule. So it's about 2.5 centimeter long, and in diameter is 1.5. So, and I can see another bat mark over here in the nickel of the hand. So that is a bat mark. Do you have any surgery?
No.
Do you have any family history of skin cancer or any surgical procedure?
No.
Do you have any wound, any
No.
open skin?
No.
Okay, do you feel any warm or unnecessary cold?
No.
So, okay, the Miss Mary's skin is intact. So I'm checking Miss Mary for uniformity, and the entire skin surface. I'm exposing it to see the color and the uniformity, and see if it is normal. But and lesion, there's no lesion, there's no disunity, there's no disformity. So Miss Mary's skin is normal. So we're moving from the skin, and before I move to another section, but I need to palpate the skin and tell the texture for warmness. That's the texture. So Miss Mary's skin is warm. It's not cold. And towards the leg, there is a scatter scar due to the previous bruises and abrasion. So to the bilateral low limbs, because they are around the shin area, bilateral shin. So, but along the nail, which is usual, it's more darker than any other part, because there's a lot of skin fold there that are more thicker than any other skin. Miss Mary's skin is soft. It's not hard. There's no any lump in the skin. There's no mold, and there's no problem in our skin. So now we are moving from the skin. We are moving to the hair. I want to look at Miss Mary here. Miss Mary, you can either sit up or okay. Thank you. So first of all, I'm inspecting. I'm looking. The hair color is black and with good texture. It's not easily broke, and there's no uh, uh, skin hair loss. It's well distributed. No alopecia, no infection, no lice infestation, and it has good hygiene. So, and there's no problem with there's no surgical. I'm palpating it. There is no surgical mark. Do you do any surgery on your hair?
No.
And do you have problem in your hair loss, or are
No.
you noticing your hair is you are losing hair,
No.
or your hair is broken easily?
No.
So Miss Mary hair is good for now. So there's no lump, there's no wound in between, there's no surgical scar inside. So everything look good. The texture is good. And I'm moving from the hair, I'm moving to the nail. First of all, I want to look at the nail. I want to look at the color, the length, the condition, the configure, the symmetrical, and the cleanness. So Miss Mary, nail is is good. I'm inspecting it. It's neat and it's well shaped. There's no clubbing uh, nail. There's no infection. There's no manifestation of infection, and there's no thickness. The texture is normal. And especially for the old adults, the old people, their nail is normally thicker than any, even both legs nail is normal. There's no thickness, there's no breaking, and it's not soft. There's no ingrown nail. There's no infection, like a fungal infection, like you can see some nail is very black where other is pink. The capillary refill is normal and the nail is pink. So there's no problem with Miss Mary nail. And I want to share for the nail base angle. Nail base angle, the normal nail base angle is about 160 degree. It should not be more than 180. But in an abnormal clubbing nail, it's always above 180, like a COPD patient and the patient that smoked for a long, long time. So I'm checking the angle. Let me measure the angle. It's not more than 160 degree, so which is normal in this case. So um that's all we have for now. And I'm checking the prominent, the proximal, and the lateral nail fold. There's no abnormality, no redness, no swelling, no pain. Do you feel any pain, Miss Mary?
No.
You sure?
Yes.
So there's no, even in your leg, there's no pain there.
No.
You don't have any problem with your nail.
No.
You are not diabetic. You don't have to go to from any doctor to cut your nail.
No.
So, all right, everything is good with Miss Mary. Thank you, and we'll be moving on to uh